So I'm Julie Parsonnet. I'm an infectious disease doctor, and you may kind of wonder why an infectious disease doctor is here. But for a couple of reasons. First, since Sandy Hook, I've been involved with Moms Demand Action, and then my husband, who's also an infectious disease doctor, had been nominated to be Assistant Secretary of Defense for Health Affairs. And at his Senate hearing, which was back in, I can't remember, 2017, I guess, it was the year of the Sandy Hook, not the Sandy Hook, the Sunderland Springs shooting in Texas. Somebody asked him about it at his Senate hearing, why an Air Force veteran was allowed to have a gun, somebody who'd had mental illness. And he said, well, I think in general, it's insane that Americans can buy AR-15s and civilians can have AR-15s. And they shut down his hearing, and he was not allowed to continue on for that position because of his feelings about gun control. And it made me very aware that this is never going to happen. Things are not going to happen at a federal level, that things are really going to happen to prevent gun injuries at a ground level and by physicians and by local communities and state level people pushing forward for looking at this as a public health issue and trying to prevent injuries and deaths by really taking some very logical and public health oriented approaches. And so that's what got me much more engaged. And we started SAFE, which is a group of 50 medical schools around the country trying to get more medical schools. So if you're at a medical school and you're not involved in SAFE, please let us know. And teaching doctors how to help shift the way firearms are thought about and handled in homes in the United States. So I'm just really going to talk today about sort of just the epidemiology of where we have guns and how firearms injuries occur, and let that just be a grounding for the rest of the talks that are going to be talking about some ways that we can help manage that. So, and I know that I'm probably preaching completely to the choir here because the people who are here are all interested in gun violence prevention. You probably know all these figures, but I'm going to run through them because, again, I think we just need to all be somewhere in the same space. So these are the top 10 civilian gun owning countries in the world. And as you can see, the United States leads the list. And the countries that are most closely behind us are ones which have experienced considerable amounts of violence. And you can see that first, that there are more guns than there are residents in the United States. And because there are some people who have lots and lots of guns. But when it comes down to it, somewhere a considerable proportion of households, I think, I actually don't remember the exact figure, but somewhere around 40% of households are gun-owning households in the United States. And one of the really interesting things about firearms is that they tend to be purchased sometimes not when you expect them. So I would have thought after a mass shooting, maybe people wouldn't want to buy guns, but anytime there's a stressful event, people go out and purchase firearms. And so you can see after Sandy Hook and San Bernardino and Parkland shootings, there were big bursts in firearm sales. And there's been an especially large burst of firearm sales after COVID and all the lockdowns with COVID and the social unrest on January 6th. And many of these purchases are for first-time purchasers, and so people who hadn't previously been gun owners. So this is a survey that was done in May, so after the beginning of the COVID epidemic, and about 40% of all gun sales in that year, according to the national firearms, one of the national firearms trade associations, were to first-time gun owners. And the great majority of these, as you see on the bottom, it's a kind of funny figure at the bottom, but the most purchased were semi-automatic handguns. And semi-automatic handguns are really, their only purpose is for shooting people. There's no other purpose outside of that. They're not like rifles that people use for hunting. They are really meant for self-protection or for injury to other humans in the end, other than just firing ranges. I'll say that some people do enjoy that, and it's actually kind of fun. But purchasing it and having it in your home, the main purpose is for self-protection and for shooting at a human being. So I'm going to go away from the actual gun sales and just talk about deaths. And I'm sure, as many of you know, firearms injuries and deaths have now exceeded those of of automobile accidents. And that's been over the last 2 years. And again, this year, I think we're pretty confident that once again, firearms deaths will exceed motor vehicle deaths. And firearms injuries and homicides still remain among the leading causes of death in young adults, particularly African-American adults, but adults in general, and one of the leading causes of death as well in children. One of the interesting things when I look at this is you can see we've made enormous progress in motor vehicle accidents. And this doesn't go back nearly as far. If you go back and start looking back to the 1960s and when Ralph Nader wrote his book, Unsafe at Any Speed, you can see really huge drops in motor vehicle accidents. And a lot of that, and it was done without removing our cars. We all still drive cars. So these efforts were done by changing rules about cars and putting in seatbelts and putting in airbags and working with making drunk driving illegal, and now dealing with distracted driving and making laws about distracted driving. And so they've made lots of efforts to diminish motor vehicle accidents through those methods. But firearms have a much bigger challenge than that, because the manufacturers don't have any interest in changing manufacturing of guns to make them safer. They are exempt from lawsuits, and they don't have any real desire to make guns safer. So we really have to focus on things that can be done by the population rather than by the manufacturers. So most of what's happened with motor vehicles has really been improved by the manufacturers and somewhat by federal law and state laws. But we have to really work on some of the culture around gun violence. And I think that's really going to have to be, it's going to have to be a ground up swell to decrease firearms injuries and deaths. These are just the numbers from, just so you can see the changes over the last 5 or 6 years. And you can see this is a theme that I'm sure will also come out very strongly today when we start talking about safe storage and ERPO laws, that the majority of firearms deaths are still suicides. So 2/3 of them are suicides, and 1/3 of them are homicides. And a few of them are accidental deaths, a small percentage. The main point here is that virtually all of these numbers, deaths, suicides, injuries, children, teens, mass shootings, and are all going up and have been going up over the last 6 or 7 years. The only one that seems to be maybe trailing off a little bit is the one that people want, which is defensive shootings. And if you add in now, this year's projected numbers, those can be seen here. And these are not incomplete. But these are the numbers on November 8th are the ones that are not in parentheses, and then the extrapolation to what the year will look like if we use the same rate over the rest of the year. And you can see that this is going to be, unfortunately, another banner year of deaths from gun violence in the United States, with an estimated 20,000 homicides in the United States, and a big increase again, probably in mass shootings going from 269 in 2014 to 719, and not actually a big increase in suicides, despite COVID and the expected increase, big bump in suicides that were expected to be seen by the stresses of COVID and sheltering in place. Those have not been as apparent as some of the other forms of gun injury and death. So just a couple final slides. This just is a picture again of the total deaths is 38,003. This is in 2019. And again, with the suicides and homicides making a major contribution. And I actually like this slide because it gives you a perspective on the whole picture of accidental deaths, homicides, and suicides, and where firearms fit into that picture. And I put it a little bit of a grain of salt around the proportion that are in the mentally ill. I don't think we really know so much the role of mental illness in some of homicides and suicides. But I will point out that guns make up only a small percentage of accidental deaths, but they make up the majority of all homicides and suicides in the United States. And that most of these are, at least most of the suicides and many of the homicides, I think, could be preventable by the public health actions that we'll be hearing about today.